Hi everyone, thanks so much for joining. This is Dr. Steve Kahn. Don't forget to like, subscribe, and share for more of this content. So today we're going to be taking a look at a very important gland and some hormones that are oftentimes forgotten. In this case, we're taking a look at the backside or the posterior part of the thyroid gland, and we're looking at 2 to 4 to 6 pea-sized shaped glands called the parathyroid glands. Now, these little structures that are found on the posterior side of your thyroid gland have a very important function. Their main job is to secrete a hormone called parathyroid hormone, PTH, from these specialized cells called principal cells or chief cells. Now, the chief cells or principal cells, what they end up doing is they secrete parathyroid hormone. Parathyroid hormone has its effect on our bone. So what does it do in bone? It's going to stimulate the osteoclast. The osteoclast, remember, are a type of macrophage, a macrophage in bone that are going to basically munch on that bone and liberate calcium. So calcium we store in bone. This hormone stimulates the osteoclast, which is a macrophage, to munch on that bone to liberate more of that calcium from bone into blood. So it's going to increase my blood calcium levels. So if my blood calcium levels are low and my diet's not adequate, I'm going to start looking for that calcium in its richest source, which is bone. So this gland gets stimulated, parathyroid gland, which is going to stimulate parathyroid hormone from chief cells, principal cells, to basically target bone, specifically the osteoclast, that's going to munch on bone to liberate calcium, that's going to increase my blood calcium levels. And it's the antagonist to another hormone that's going to decrease my blood calcium levels, which comes from the thyroid gland. So the thyroid gland produces a hormone called calcitonin, and calcitonin has the opposite effect, or the antagonistic effect of parathyroid hormone, which is to decrease my blood calcium levels and deposit calcium into bone, principally bone. So those are the way these two hormones kind of work. You have an antagonistic agonistic relationship. So that's what parathyroid hormone does. So again, to understand it, parathyroid hormone is going to be produced by the parathyroid gland, which are 4 to 6 little pea-sized glands on the posterior side of the thyroid gland. And their main job is to produce a hormone called parathyroid hormone that's going to increase my blood calcium levels. Where's that calcium coming from? Yes, there's sources in the kidney, there's sources in the digestive tract, but the big one to keep in mind here is going to be from bone, right? So keep that in mind. Thanks so much for joining. See you in the next one.